Welcome to Neuron Academy daily quiz discussion 75, number 75. The question is type of consent in case of medical emergency where doctors start emergency treatment to patients who cannot give informed consent and for whom no immediate family can be reached to make such decisions. Options are implied, absent, process, and written informed. Question means one patient came to medical emergency and there is no family members available or relatives available to give decisions or to give consent. In that case, what type of consent we will take? Okay, so before discussing the answer, we will go to the type of consent or we will see the type of consent in short. What is consent? Consent means it's the permission or agreement given by the patient or patient relatives in some situations. So the first type is implied or tacit consent. Implied or tacit consent means when a person is coming to a OPD or emergency department. Imagine one patient is coming to your department, OPD department or emergency department. So when one person is coming to a hospital means he's already agreed to get a consultation or to undergo some physical examination, other blood investigation, etc. So in that case, no need to ask to the patient we are going to do to get consent or something, because already patient agreed. But that's why patient is coming to your department to get treatment. So no need to get any type of consent from the patient. There is the consent already, patient is agreed. That's why he is coming to the hospital. So this type of consent is called as implied or tacit. But after that, if we feel that okay, we have to do some certain procedures and detailed procedures, so in that case we have to get consent from the patient. So this is called as expressed consent. Expressed consent, you can take it as a oral or written. Means you will tell them that okay, we are going to do this scanning, we are going to do some certain procedures, or we have to do some detailed physical examination, etc. So in that case we will inform, you will inform the patient and we will get the consent. This is called as expressed consent. That may be oral or written. Written consent is always good. Informed consent, the third type is informed consent. Informed consent means suppose you are going to do some surgery, some detailed procedure, some major surgeries, minor or major, whatever may be. So this type of procedure need informed consent. Means we have to inform the patient, or patient need details like what type of procedure, what will happen after the procedure, what will be the cost, consequences, and its progress, success, all those things patient need. So we have to give some counseling, we have to give more details. That type of consent called as informed. Okay, so implied means for initial consent, that is already there. Expressed means for some type of procedures we will inform, okay, we are going to do this, we are going to do this type of procedure, etc. But when you are going to do a more critical procedure, more major procedures, then time you have to inform the patient. You have to get informed consent. Informed consent means, as I told you, you will give counseling to the patient, you will give every details of the procedure. Okay, next comes proxy. Proxy means in some situations whether the patient may be unconscious, or patient may be there will not be the patient cannot give himself consent because patient is unconscious, or mentally ill patients, or sometime minor patients, like that. In that situations, some other people instead of patient, some other people can give consent. So this is called proxy consent. Advanced consent means before death of the patient, before death we can take some consent. That is called advanced consent. Then comes surrogate consent. Surrogate consent means for minor people, those people who are below 12 years old, like children. We can get consent from families or parents. That is called a surrogate consent. So these are the important consents in um, in the health systems. Okay. Next thing is some consents will not be valid. Suppose if the patient is mentally ill, or sometime if the patient is drowsy, not conscious, all those things. In that situation, if the patients like drowsy patient or mentally ill patient, if they are giving some consent, it is not valid. And who can make a consent? Person above 12 years can give a consent. Persons above 12 years. Below 12 years, they have to we can take the consent from parents or other relatives. Okay. In some situations, when the police is bringing some patients, or if mentally ill patients, in that situations, no need to take consent also. So these are the important points regarding consents. Implied, expressed, informed, proxy, advanced, surrogate. Okay. To remember these consent is in easy manner, just think that one patient is coming to your department. So the patient is coming to your department telling that I want some treatment. So he's already agreed to do some treatment. So this is called see the doctor, to do blood investigations, all those things. So this is implied already there. It is by default, there is the agreement, that is implied or tacit. And after that, this patient, we think that we have to do some certain procedures, so we will take consent from the patient, express the consent. It may be orally or written, that like you will inform, okay, we are going to do this procedure. Orally you can take the consent. Next, you think that if you need that the patient has to undergo some big procedures, like surgery or something else, something like that. In that case, you explain every detail, that is informed. Okay. So these three things are understood. Proxy, as I told, when the patient is unconscious, or a patient is mentally ill, in that situations, relatives or other family members can give consent, that is proxy consent. Advanced means consent giving before death. Okay. Surrogate means for the children, the family members like parents are giving consent. So these are the different consents. So in this case, in this question, see, one person came to in this question, see, one person came to medical emergency, and there is no family members or any other people to give informed consent or something. So it is, the answer will be implied consent, because there is no people to give consent, and he came to emergency, that he is willing to undergo some some treatment or something else. So the doctor himself can take decisions and give treatment. So this is called implied consent. So the answer will be a implied consent.